Good morning to you on this Thursday. It's March 11th. Glad you're with us on this American Morning. I'm Kieran Chetry.
And I'm Jim Acosta.
And in Hollywood, mourning the death of actor Corey Haim. The 80s heartthrob died early yesterday. His manager says he was fighting a winning battle with drugs, working with a team of addiction specialists. Haim's closest friend and frequent co-star Corey Feldman sat down with our Larry King to talk about it last night.
The first thing I need to say is people need to stop. They need to stop jumping the gun. They need to stop saying it's a drug overdose. They need to stop saying, their theories of what they think it is or isn't. Because at the end of the day, until the coroner's report comes out, until we have specific evidence, until we know exactly what the toxicology reports say, nobody knows.
Corey Feldman went on to say his friend's drug problems were well known, and he's, quote, been the guy stuffing charcoal down his throat while he was ODing. Just shocking stuff.
It is, and for a lot of people that know him, he was quite transparent about his struggles, saying that he'd been in and out of rehab, that he was a frequent relapser or a chronic relapser. That's what he called himself. His death, though, and the recent death of actress Brittany Murphy, bringing the problem of drug abuse back into the limelight. Here for the AM Breakdown is Dr. Joseph Lee, an adolescent addiction specialist with the Hazelden Addiction Center. Dr. Lee, thanks for being with us this morning.
Good morning. Thanks for having me.
Do you agree with other experts in this field that the use of prescription drugs, as in particular, as well as illicit drugs, is growing? What are the factors that are contributing to that?
Well, before I get to that question, I think on behalf of the Hazelden family, I'd like to offer sincere condolences to Corey Haim's family and loved ones. And out of respect for Mr. Haim, as Mr. Feldman said, I don't want to speculate about how he may have passed away, because it may have simply been a medical issue. Getting to your question about prescription drug abuse, the general issue is really about addiction, and people are addicted to different things. Compared to previous decades, we have seen a ramping up of prescription drug abuse. Every day, there are 7,000 new people who abuse prescription drugs for the very first time. And this is an alarming problem. To be fair, over the past 5 or 6 years, the numbers have plateaued or gone down a very little bit. But there are still concerning populations, ages 12 to 17 and 18 to 25 in particular. And Corey Haim's story is really about teenage and adolescent addiction, because though he passed away around 38, his addiction problems began when he was a teenager.
And we agree with waiting until all the facts come out. That's why we've run that clip all morning from Corey Feldman. Tell me, doctor, where are kids getting these drugs from? Is it the medicine cabinet, online pharmacies? Where is it coming from?
Well, it might surprise some people, but the vast majority of kids are getting these prescription drugs from friends and loved ones. And so we need to be very vigilant about how these medications are distributed and regulated.
But clearly we're seeing that there doesn't seem to be that vigilance, meaning that when you talk to the kids, they say that, listen, this is astounding, 62% of them say that they were able to get them from their parents' medicine cabinet. I mean, are so many people in need of narcotics and anti-anxiety medications and all of this that it's just so easy to get? The kids can go shopping in their parents' medicine chests?
Well, I think part of the problem is just how information is disseminated in society today. There's a lot of quick information that people can get. We live in kind of a soundbite, quick-fix society. And I think kids, when they hear things like medication and prescription and safe or legal, they confuse all the terms together and don't realize that these are potentially dangerous chemicals, especially if taken in combination.
And what about the constant advertising that we see on television for pharmaceuticals? You think that's a good idea?
Well, before we sensationalize pharmaceuticals altogether, I mean, I don't think anyone would make the argument that America is under-medicated in any way. That being said, the majority of people, the vast majority of people who get prescribed medications take them appropriately. There's a subset population of people who are at high risk for addiction and other risky behaviors who abuse these drugs, and that's really the warning sign.
What about the fact that so many people seem to be in a revolving door when it comes to rehabilitation? I mean, Corey Haim himself talked about being in and out of rehab 15 times. Are there some people that rehab just doesn't work?
Well, that's an excellent question. And again, it has to do with how information about addiction comes out in today's society. Sometimes we make a caricature of people who've been in rehab in and out. And I think people start to use rehab as an excuse sometimes, and the truth really needs to come out that addiction is a health issue. It's a chronic disease. It's a lifelong illness, much like diabetes is. And people have ups and downs with it. Young kids these days see celebrities going to rehab, and they have these conceptions about rehab. Anyone can go to the hospital for 30 days and be well and come back and they're fine. And addiction is not like the flu. It's something that stays with you. And we really saw Corey Haim and other celebrities have their struggles and victories with it.
All right.
Thanks, Dr. Joseph Lee, joining us this morning. Appreciate your input.
Great. Thank you very much for your time.